Hello, welcome, welcome. I am Katrina Pratt Roebuck, and I am bringing here today with me Kyle Carter of NAMI Philadelphia to talk about the work that he does in the behavioral health space. And so, just really excited to bring you another episode highlighting some of the good work happening in our community. So, Kyle Carter, thank you for being here. I
Thank
appreciate
you
it.
for having me. Thank you so much.
So, can you tell us a little bit about NAMI Philadelphia, the work you do, and some of the core services that you provide?
Oh, that's a big question. NAMI Philadelphia. So I'm still learning and growing. I'm going into month number 11. Previously, obviously, I worked with you with DBHIDS. But NAMI itself, we are one of 600 affiliates across the country. NAMI is a national organization. Of course, NAMI stands for National Alliance on Mental Illness.
Mhm.
So our tenets of our service are training, education, and advocacy.
Okay.
So our programming kind of stretches across that. So we have everything from youth-based services, youth program navigating work, youth peer mentor work,
Mhm.
suicide prevention. We're positioned at local colleges. We run the gamut of supports, but then we also have our support groups. So we have 6+ support groups ranging from women, men, BIPOC, gun violence, grief. We have family to family and peer to peer, which are NAMI signature programs,
Mhm.
and a number of other things that I'd probably have to give you a slide deck in order to keep up with everything. And we're learning and growing every day. So those are just a few things.
Okay, thank you. Thank you for sharing sort of the scope of the work. I'm curious to know what activities NAMI does that perhaps the general public is not well aware of. Wanted to ask you to highlight some of the work that you do that people could connect to that don't know about those programs currently.
So one of the things that, obviously we've expanded upon some of our youth programming. So we have some mentoring programming that is coming up. So we really expanded and growing that out. We have young professional leaders, which establishes our continuum. So we have NAMI on campus, which we have in
Mm.
local colleges, but then young professional leaders is extending past that. What do you do once you graduate, and how do you handle all those travails as you try to kind of root your path in the world? So we
Right.
have that. And what we also have that we started late last year are wellness presentations for
Okay.
nonprofits and for-profit organizations and corporations. I'm going to give a big shout out to New Vitae Wellness, along with Syncora for being our partners with that. So we're expanding that, and we have a few others scheduled for 2024.
Okay, okay. So just wanted to sort of get a little bit more detail, if you don't mind, around the youth component. So you said when people are graduating from high school or graduating college and sort of navigating into adulthood, did I hear that correctly?
Yeah, so what we're trying to do is we're trying to establish a continuum of youth services. So we have our
Okay.
NAMI on campus program, which we are in 4 colleges across the city. And basically, what we want to do is kind of be the big brothers of the schools. We know that students have unique challenges and anxieties and things as they navigate. Some of them are first-time college students generationally. Some of them are away from home. Some of them are law students and med students, but a lot of different anxieties around that. And they need
Mhm.
support. Students know what students need. So what we want to do is position ourselves as the largest grassroots mental health organization in the country, that we have resources. We have, data-driven supports that we can offer to them. So we want to make sure that we stand up. We allow them to use our composition, which is a board composition, and have access to all our resources. And that we support them throughout their process. So they have their own board, they have their own treasurer, president, etc. And that's the NAMI on campus piece. So while they're in college. Previous to that, we're actually also starting NAMI on campus in high schools as well to help
Mm.
prepare students for the process of integrating themselves. Again, so giving them some of those resources and kind of what to expect model as well. And then the end game is the young professional leaders. Once you graduate and now you're navigating, it's like, oh, I got to get a job. I
Mm.
have to figure out what my place is in the world. I have to navigate all these things, all these deadlines, all these anxieties around being an adult.
Mhm.
We want to make sure we support you there as well. So I want to give a huge shout out to Lexi Taylor, who is our youth and advocacy manager that's managing a lot of those programs as we grow.
Okay. Can you tell me a little bit? First of all, that's great, and I think very needed. Can you talk a little bit about how someone can connect to those programs? So, say NAMI is not on our campus. Can I connect to the NAMI campus programs? How do folks connect if they need some supports?
Absolutely. So the best way to connect to any of our programs, whether it's support groups, whether it's NAMI on campus, whether it's young professional leaders, is NAMIPhilly.org. So that's NAMIPhilly.org. And you want to navigate to the contact us tab, and feel free to just send us an email. We'll make sure to get right back to you and find out exactly what your unique needs are. And then we'll make sure to route you to the right place.
Okay. Can you talk to me a little bit as well about the difference between, say, someone having a mental health crisis and where they would go versus connecting with NAMI? What would be the difference in terms of how one would navigate behavioral health resources?
Excellent question. So one of the additional resources that we do offer is our warm line, which is our hotline that we offer for folks that need specific mental linkages to mental health and behavioral health supports and resources. So we want to make sure to delineate that line between that and somebody that is in crisis. Then we would navigate them to a 988 or the Philadelphia crisis line. So what we do is we triage. Someone can call into our line. Again, you can get all the information from our website as far as where to call
Mhm.
to access the warm line. We would find out exactly what you need. Again, someone would answer the phone and ask the question, what service or support do you need? Are you in crisis? If they say they're in crisis, we would immediately route them to 988 or the Philadelphia crisis line. But if you generally need support, example, I need outpatient supports for my child, for my youth,
Mhm.
then we'd be able to connect you in the right place.
Okay. All right. Thank you. I appreciate you explaining that further. I think that this is going to be very valuable information, in particular to youth who might want to reach out, just don't know where to go, how to get started, and not, know what the differences are between who to call in a crisis versus who to call when you need some support. So thank you for explaining that. Um, can you talk a little bit about, because I'm very, I know you and am very excited about the work that you've been doing at NAMI, and just wanted to get from you what your vision is for 2024. What are some of the goals that you want NAMI to accomplish in this year?
Oh, well, you know me very well as you have supported me throughout the years. I'm a very creative soul. So I think my vision is, what I've sometimes I have to temper some of that creativity and be as realistic as possible. But I think just continued expansion and capacity building. So really honing down on our signature programming, expanding additionally some of our youth work, really expanding our advocacy work at the city,
Okay.
state, and federal level as well. So we have an exciting initiative that'll be coming later this year with PHMC called Advocacy Ambassadors, in which we'll be training some of our community folks to learn how to advocate appropriately and have I think foster really positive relations with politicians in our area. So we have some exciting things in that space. But I think expanding our youth programming, expanding our advocacy work, and just capacity building and really honing in on kind of what our strategic plan is really going to be for the next 5 to 10 years.
Okay, that's great. That's great. So, I'm very excited to hear that you're also working with other community-based organizations, behavioral health organizations. I think that it's really important to leverage the resources and to work together around the advocacy piece. So that's really exciting that you'll be working with PHMC on that. Can you tell me a little bit as we're going to wrap up this conversation? I wanted to just make sure that I ask you, can people volunteer with NAMI? Is there an opportunity to volunteer? And then secondly, we'd love to know how someone could donate to NAMI to continue to have your programs expand. Can you talk a little bit about
Absolutely.
those two things? Thanks.
Thank you, thank you, thank you. I appreciate you asking those questions. So I hate to, be redundant, but the website is, and I've worked really hard on ensure that that website is kind of the one-stop shop for everything. So as soon as you go to our landing page, it has a donate button right there that you can tap and donate anything that you can. So you're free to one time or monthly donation as well. And I want to say a huge thank you to all our supporters and stakeholders for their continued support with us being able to offer these free programs every day. As far as people wanting to volunteer, again, navigate into that contact us tab, letting us know that you want to volunteer. I want to give a huge shout out to James, who's our new volunteer coordinator, who will receive those contact us tabs, and then he'll help navigate you to the exact area in which you'd like to volunteer.
Okay, thank you. And we will put all of this information in the notes and the link to where this is posted. It'll be on a couple of social media sites as well as YouTube. So very looking forward to people supporting your work and looking to see how you expand over the next several months, and really excited to support you. So thank you so much for spending time with us today.
Thank you so much. And I wish you the best of success in all that you do.
Thank you. Bye-bye.